Good afternoon. Today we're going to talk about sequential compression device application in the emergency department. Our aim statement for this project was SCD application and documentation compliance in patients admitted with stroke-like symptoms will be at 50% by October 1st, 2024, and will be at 95% by January 1st of 2025. I will say that with the initiatives that we've implemented, October 1st, we were at 75%, so I feel like we're going to far exceed our goal of 95% in January. So why is this important? Well, in patients that have stroke-like symptoms, mobility is a major issue. This can cause venous thromboembolisms, deep vein thrombosis, and pulmonary embolism, and not to mention the fact that this affects about 1 million patients a year in the United States. So we did a SWOT and gap analysis, and we found that SCD orders were not carried out promptly. The ED nurses had 4 hours in which to release and initiate inpatient orders. The stroke program manager set a goal of 2 hours before they were released and implemented, which meant that we fell out on almost every patient every time we did an audit. We didn't have enough SCDs available for the ER to use. The ER nurse didn't know how to properly apply SCDs, and they didn't have a consistent place to document when SCDs were initiated, which meant whoever did the audit was spending a lot of time trying to figure out where it was documented and having to look a lot of different places. The ED nurse also was unaware that Joint Commission looks at this, and in order for us to maintain our stroke certification, SCD application timely is one of the initiatives they look at. We found out that we didn't have stroke champions in the ED, and the ED wasn't really involved in our monthly stroke meetings that we had. So we wanted to get them involved there. And then the ER nurse is also taking care of ER patients at the same time they're taking care of boarded patients. So deciding which one orders need to be carried out timely and first is a little bit of a different thought process than what they normally have. So some changes that we did and some interventions. So we wanted to get our frontline staff involved because they're the ones that actually can affect the change. We did get with our electronic health record vendor, and we looked at how do we document, where do we document, and that sort of thing. So the informatics nurse got together with the ED, and we developed a tip sheet on how to document application of the SCD. We also got with informatics, and they developed a specific place for documentation for the ED staff. So it was something that was very easy to find. We did education on how do you apply SCDs appropriately and why do you apply them. And then we had communication with the providers. So we actually started multidisciplinary rounds in the ED. So that way nurses could communicate with the provider if a patient refused them for whatever reason or they didn't have SCDs applied. With this, that gave the provider time to either discontinue the order and order oral anticoagulants or speak with the patient and talk to them about the risk and benefits and try to get them to where they wouldn't refuse them. The ED did daily audits, and with those audits, they were able to do feedback to the nurses for any deficit that we saw. The stroke program manager also did audits in real time during the weekday and was able to round in the department and talk to them about stroke patients and really help solidify what they were doing for stroke patients that were held. And then we had informatics that was able to, in real time, come down to the department and really help and show how do you document and where you document, which really helped a lot for those ER patients. And then we were able to get this metric added to our monthly stroke meeting. And with the ED coming into that monthly meeting, they were able to really see where they were falling behind and then what their wins were. So in order for this change in practice to be successful, we had to have active support from our senior leadership. We had to have active support and involvement from the ED leadership, as well as from the ED frontline nurses and the stroke champions in the department. We had informatics nurse on site that was available. We had active involvement from our stroke program manager, and then monthly stroke meetings in order to, like I say, discuss barriers and wins in the department. So if you have any questions, please let me know, put them in the chat. I'll be glad to answer them. And I hope you have a good afternoon. Thank you.